Let's talk cesarean birth. This is part 2. I want to introduce some of the gentle cesarean concepts that are out there. I am doula Terry. I've been a birth doula in New York City for more than 20 years now. One of the things that I love, it's a great idea because they've always been in the way, is to ask the anesthesia team to put the leads. You'll have a little, them as like EKG stickers and leads that are attached to your chest so that they can keep track of your breathing and know that you're well. You can ask them to be on your shoulders and down your back instead of on and around your chest area, which is where they're going to continue to live even when you bring your baby to the breast. A great idea is to talk to anesthesia ahead of time. Ask if the leads can be on your shoulders and down your back. You'll have a lot more comfort when we get to skin time. Speaking of skin to skin, we definitely want to go ahead and ask that our baby be brought to us as soon as possible. For a few lucky people with cesarean birth, there are some places where they really are birthing your baby and the baby comes right skin to skin for you. For us in New York City, certainly the baby goes to the warmer, is checked out by the pediatricians, they do some evaluating, and then usually in our scenario the baby is handed to the partner who's going to sit right by mama and we can have cheek to cheek. You can absolutely during the surgery put your baby skin to skin, but keep in mind from about the breast down we have sterile fields. We don't have room for all of this, but we can have a baby skin to skin in the OR up here on our chest if we want to, or if we're feeling a little too overwhelmed, we can have our partner right there holding our baby. We can do cheek to cheek, we can sing to them, we can talk to them, or we can also know that our partner can hold that baby and keep them safe and comfortable until you are ready. And that's a really important theme. I want you to have, for gentle cesarean birth, I want skin to skin if you want it. I want those leads out of the way. I'd like you to have delayed cord clamping if there's room for that, up to a minute. But I also want to make sure that nobody is kind of pushing you to take on your baby before you feel ready. You can be feeling a lot. As I said in part 1 of this, you can have shakes, you can have nausea, we can address that. But you may not quite be ready to hold your baby, maybe not until you're out of your surgery and in the recovery room. That's fine. Whenever your baby gets to skin with you, they're going to be so happy to be there, they're going to relax, and they will initiate their desire to breastfeed and do all that when they are ready too. And they may not be ready right away. But it's important that you don't feel rushed, that you have as much time with your baby as you wish, and do it in whatever capacity works for you. I just want to protect that time for you, and I want you to know your baby can be cared for well by your partner, or it can be skin to skin with you. Up to you, and you might want to just see how it goes.